Hi, my name is Jerica Singleton, and I was one of the pharmacists that consulted Miss KL this morning. She's a 40-year-old female who presented to the ER with reddish-brown emesis and severe nausea. She was then admitted to the ICU for a GI bleed and weight gain in the abdominal area. For background information, she naps often during the day and has trouble traveling to her primary care physician, which leads to lack of follow-up. She currently lives with her boyfriend and children. She drinks about 1 pint of hard liquor a day and smokes 1 pack of cigarettes. She is 5'5", 98 kilograms, and has a creatinine clearance of 30.6 milliliters per minute. She has a penicillin allergy, which gives her a GI upset, and she only takes ibuprofen at home as needed for pain. Upon physical examination, she is obese and appears older than her stated age, jaundiced eyes, labored breathing, distended abdomen with hepatosplenomegaly, and also has positive Babinski signs, asterisk, spider angioma, and 1+ pitting edema in the lower extremities. She also seemed extremely confused and drowsy. Her recent pertinent labs include an elevated chlorine at 109, high AST-ALT ratio of 2.27 to 1, high hemoglobin, iron total bili of 9.2, 1.6, and 7.5 respectively, and low hematocrit phos at 30.2 and 2.3. Her current blood pressure is 99/71 millimeters of mercury. And so far in the hospital, she's been given 1 liter of normal saline, 25 micrograms per hour IV of octreotide, 4 milligrams of IV Zofran, PRN Vernaggia, 1 milligram of folic acid by mouth daily, IV Protonix 8 milligrams per hour, a 7 milligram nicotine patch that's changed daily, and 25 milligrams of chlordiazepoxide every hour as needed for alcohol withdrawal symptoms. We've also calculated a MELD score of 27 and a Child-Pugh category C for Miss KL. So for the patient's assessment and plan, we find that she has liver disease and cirrhosis due to variceal bleeding, ascites, HRS coupled with high AST-ALT ratio and jaundiced eyes. So that indicates cirrhosis and end-stage liver disease. This is most likely due to the lack of follow-up with her primary care physician and the alcohol use she does daily. Upon discharge, we talked to the patient about the importance of medication adherence, smoking cessation, alcohol cessation, and we also want to recommend a social worker to help her with transportation to her PCP, since that is what she indicated is the hardest part. For the variceal bleeding, this is because of the patient's history of liver disease, and this is indicated by her current bloody emesis. It is possible that the varice is actively bleeding. We recommend continued treatment with the octreotide 25 milligrams IV, and it should be continued for the next 3 to 5 days unless indicated for the patient's HRS. We also recommend banding procedure, which will help with active bleeding, and secondary prophylaxis with a beta blocker such as propranolol 20 milligrams BID, titrated for the patient's heart rate with a goal of reduced HVPG of less than 12 milligrams of mercury. We also recommend antibiotic prophylaxis of ceftriaxone 1 milligram IV for 7 days. This is shown favorable for Child-Pugh score of C. The patient also has AKI and hepatorenal syndrome. This is due to the elevated serum creatinine and consequently the decreased creatinine clearance. Mortality is extremely high with HRS. The octreotide will help with the active bleeding in conjunction with midodrine, 5 milligrams PO 3 times a day. This patient is going to need a liver transplant. We talked to her about getting her on the transplant list and the importance of alcohol cessation and smoking cessation. The patient's ascites is indicated by the swelling of the abdomen and weight gain in the abdominal area. This is secondary to the liver disease. We recommend a large volume paracentesis of 8 liters with a dosing of albumin 60 grams IV used in conjunction to remove the fluid from the abdomen while minimizing complications. We also recommend initiation of spironolactone 25 milligrams and furosemide 10 milligrams for diuretic therapy to get rid of the excess water. Hepatic encephalopathy is suspected and in this patient, and we recommend lifetime lactulose therapy. The patient also is experiencing anemia and thrombocytopenia and may need oral iron supplementation. Overall, we recommend monitoring with the serum creatinine, LFTs, blood pressure, heart rate, signs and symptoms of active bleeding, and urine input and output for this patient. Thank you for your time.